What are the chances that someone is going to suffer a sudden cardiac arrest right in front of you? Well, the bad news is it can happen to anyone, anywhere, anytime. The good news is there is something you can do. Every minute that passes decreases a victim's survival chance by nearly 10%. So for the best chance of survival, you need to respond immediately. Consequently, for the best outcomes, AEDs should be available in as many locations as possible, including yours. Philips On-Site AED is easy to set up. You pull this green tab.
Self-test. In case of emergency, press the green on-off button.
And then you wait a few seconds.
If the orange button is flashing, press it. Verified.
The On-Site comes with a set of simple instructions if you have any questions. Philips On-Site AED is also easy to use. All you have to do is open the AED by pulling this lever down, and the device turns on automatically.
Begin by removing all clothing from the patient's chest. Cut clothing if needed.
Then, just follow the clear and calm voice instructions. The On-Site itself walks you through the entire rescue process and lets you do it at your own pace. And finally, maintaining a Philips On-Site AED is pretty easy too. Each system comes with a simple maintenance sticker to keep track of the two accessories, the pads and the battery, that will eventually need to be replaced. On this sticker, write down the key dates for your accessories, the install by date for your spare battery, and your expiration date for the pads. When it comes time to replace the battery and pads, all you need to do is pop out the old battery, slip in the new battery, slide this lever to pop out the old pads, and drop in the new pads. Each On-Site AED does its own self-testing every day. All you need to do is make sure this green light is blinking. So please consider buying an On-Site AED for your shop, business, or school. It's designed to help inexperienced, stressed responders deliver therapy as quickly and safely as possible.